Okay, Mulders Click. So this is another one that's a 4-foot one. So has anybody got any idea when you'd use this one? What your patient would come in complaining of?
You thought they had plantar digital neuroma.
They might do, yeah. So a neuroma is a what? Yeah, exactly. Does anybody know what kind of structure this is affecting? Is it muscle or bone or nerve? It's nerve, right. So the type of pain they will tell you they've experienced, it won't be a trauma like the other two. This one will be normally something like when I wear certain shoes, I get this shooting pain into my toes. And they can describe it like an electric shock sort of pain. The problem with this test is it's actually quite easy to get a positive for somebody who hasn't got those symptoms. So it's really important that you do it in conjunction with other tests as well. So in your 3rd year, I'm just going to fast forward you a little bit, travel in time, you're going to do some nail surgery and you'll be anaesthetising the nerves that will need to be numb in order for you to proceed with the nail surgery operation. Those nerves, you've got basically one at each corner of every digit. So if you think of it like a square. And it's the plantar nerves that can sometimes become scarred and develop a thickening. And that thickening can get trapped or caught between the metatarsal heads and twang and give them that electrical symptom. So what we want to do is see if that neuroma, which is that thickening on the nerve, is there or not. So we can go to all of them, or we can go to the primary suspects. And the ones that you're most likely to get it in are the 2nd or 3rd intermetatarsal space. Okay, so I'm going to start in the 2nd to begin with. What I'm going to do is you can see straight away I've put the foot onto sort of tension now. I've pushed it into dorsiflexion, spread the metatarsals out a little bit. And Dee is being very patient with me because I'm shoving my thumb up into the bottom of her foot at the moment and giving it a good old wriggle around. And I'm just proximal to the metatarsal heads, just proximal. So I'm kind of on them, just a tiny bit behind them. And what I'm going to do is just apply a little bit of plantar pressure over the top as well. So I'm squeezing everything between the metatarsals into that space between the metatarsals. And now I'm going to do a lateral squeeze and see if we can hear. Sometimes you hear a little clunk, sometimes you'll feel it, and sometimes we'll both feel it, and you get that. So it might be worthwhile just advising your patient that they might feel it and that they're not alarmed, you're not breaking anything inside them, because it sometimes can be quite a dramatic click. You might also reproduce their symptoms, so just be aware of that, because that won't be very pleasant for them. Now sometimes in this intermetatarsal space, 1, 2, 3, 4, you can produce a positive click with absolutely no symptoms because the nerve is relatively big compared to the metatarsal heads. So it actually can produce a false click. In you I'm just about getting it, I can just about feel it. But just maybe go along all of them. So I'm just shoving up, spreading the metatarsals, pinching down and squashing it all in, and then applying a squeeze over the top.